do you make of this strategy to kind of delay the second dose that the UK is actually trying to figure out how to keep up with the surge in cases?
I think you have to kind of separate the healthcare policy, healthcare emergencies, and the data. And those decisions should be based on data. So it's quite risky to, when we obtain the data from the clinical trial, indicate you need 2 doses of vaccine, first dose and then a booster. That is what the data that drove the efficacy, the high efficacy of these vaccines. So it's very risky to try to extend or give 1 dose in the absence of data. I mean, some of this is very ad hoc. So I understand some of the rationale to do this, but again, it's not really data driven. And so it's a very risky venture, because if it fails, you're in worse shape.
Yeah. To what extent does this somehow benefit AstraZeneca, because they only require 1 dose?
Well, the AstraZeneca vaccine does have a second dose. I mean, so they have some data on just 1 dose, but that vaccine also has a booster dose. So again, I think to go off or to deter from the data that the efficacy was driven on, I think it's a risk. But again, if you are in a situation where you want to try to extend the vaccine, the concern though is that space, that time, and how vulnerable you are. Because remember, we don't know anything or very little about the duration of protection from the vaccine. Even with 2 doses, we don't have all the data in that will indicate what the duration of protection is.
Okay, doctor, can I just clarify some things? Because you just said AstraZeneca requires 2 dosage. From what we've been reporting so far, we know that it only requires 1 dosage. Do you have any data on your end that suggests otherwise?
Just in the clinical trials, I mean, they did look at 2 doses. Maybe it only requires 1 dose, but in some of the clinical trials, they did look at 2 doses. But I think the important thing here is that to follow the best recommendation is to follow what was driven in the pivotal studies, in that interim data from the efficacy studies. So.
Right. Right.
And some of these other vaccines that are coming in the pipeline do have 1 dose, but again, the efficacy studies were based on whether it was a 2-dose schedule or a 1-dose schedule. And the point I'm making here is ideally you want to follow the data from these efficacy studies.